Welcome to Korman Plastic Surgery. I'm Dr. Josh Korman, board-certified plastic surgeon, and I'd like to welcome you all to our virtual event where we'll be covering facial rejuvenation, specifically max lift and deep plane facelift. I encourage all of you to stay till the end of the event because not only do you get exceptional promotional pricing, but also if you put any questions you have in our questions tab, then they will be answered at the end by a live team member. We have exceptional promotional pricing for anyone that signs up for the procedure and has it before the end of the year. And also, one lucky winner will get an amazing package of Botox and fillers. So thank you for being with us and join us. So the word facelift is such a confusing name and term. Everybody doesn't really want to talk about facelift, but they talk about little work or little something. But basically, we don't age like an escalator. We age like an elevator. We kind of fall like that. So what does rejuvenation, facelift, what does it mean? It basically means doing stuff surgically to the face and neck to rejuvenate, to create a more youthful appearance. So the terms are a little confusing with facelifts, and what's very in vogue you hear about is the deep plane. And that's, what does that really mean as opposed to a SMAS facelift? These are all a little bit confusing if you're not in the biz or didn't go to medical school or plastic surgery school. So what this involves is that if you think of chicken, when you have a piece of chicken, there is the gristle over the chicken, the part that you take off so you can eat and it tastes good. That gristle is the tough layer over the muscle. That's the strength layer. That is what gets pulled on during a facial rejuvenation procedure. What happens in a deep plane is that you have what's called the fixed and the mobile SMAS. SMAS is that gristle. So if we're using me as an example, there's the fixed SMAS, which is close to the front of the ear, that moves but doesn't move that much. And then there's the mobile SMAS. That's this area down here that everybody wants lifted, not pulled, not weird to the mouth, but it's this area that people want to be lifted because that's what comes down as we age. And what a deep plane does is it goes after the mobile SMAS to move up and also in the neck to create long-lasting, natural, wonderful results. Max lift sounds like max, like big, but it's not. It's MACS, which stands for minimal access, means short incision, cranial suspension, pulling up. And what it's really designed for is for jowls. It does a little bit for the neck, but it's mostly for jowls. And so what it does is it's just a small incision in front of the ear and under the skin a little bit, putting some stitches in the SMAS, the gristle on top of the muscle, and then pulling up on the jowls. So it's a very quick recovery, very natural result. You can do it under local anesthesia, and it is very, very enjoyed. It's very appreciated. People love it because it's simple, easy, natural, quick recovery, and great results. So lots of people trying to figure out what is the right procedure and what is the difference in this case between a max lift and a deep plane facelift. What is the right thing to do? And without getting too complicated, basically it has to do with the neck. If you have because obviously everybody wants the simplest, least expensive, longest lasting, best result procedure. So the main difference between a deep plane facelift, which is face and neck, and a max lift is primarily how much is the neck an issue and how much is the jowls an issue. So to give you an example, on me, a max lift would do something like this, and the deep plane neck would do this and that. It's really to help the neck in addition to the front and doing the jowls. So the difference is, and when you do, it's really about the neck. So how long is the recovery from these procedures? Well, a max lift, if you have hair that you can cover the little bit of bruising, which if it happens, in front of the ears, then you can actually go back to work really the next day. The stitches come out in a week, but they're just covered by your hair because they're just in front of the ears. The recovery for the deep plane facelift, that's probably more like 10 days. Really, it depends whether you mind people know we did anything, if there's any bruising or not, but we give you good anti-bruising products like bromelain and arnica, which helps a lot. And so the recovery generally for max lift is really just a few days, and for a deep plane facelift, you can think of it as a couple weeks. Both of them are really easy to recover from, generally low pain, and exceptionally happy results. So just like on airlines, you have so many choices, like why come to Korman Plastic Surgery? So the first thing I would tell you is that I've been doing this for more than 20 years. Two is nobody cares more about your result than you, except for me. And it is the most important. I spend a lot of time with my patients trying to make sure we're both on the same page, understand what you're trying to achieve, and I always try to underpromise and over-deliver. I have a many-decade experience teaching at Stanford University. That's also where I trained. And I have found great satisfaction in helping patients, now at this point, probably thousands of them, achieve their goals and risk their dreams. And life happens, and nobody wants you to be more happy than me. So we're talking about your face and how to get facial rejuvenation. So you would actually be a really good candidate for what we call a max lift, which is that small incision. So the incision is really small. It's in the hair here and really on the edge of the ear, in this little part of the ear. So you can actually wear your hair up and you won't even see a scar. And what it really does, if you look in the mirror, so it really pulls on the jowl. That's the part, it's lucky for you, your neck is very youthful. So we're talking for a max lift, you would be a really good candidate because this pulls up like this. It doesn't pull tight on the mouth. It's really the part that tends to age because we age like an elevator, and it pulls up like this. It also has a tendency to pull here, so the mid-face even helps with the nasolabial fold somewhat, and it creates a really nice sharp jawline that puts you back where you were several years before. So, you're very pretty, so we just try to enhance your beauty.
Hello everyone, and thank you so much for attending Dr. Korman's Max Lift and Deep Plane Facelift webinar. We were so happy that you could attend. So please check your text messages at the end of the event to be notified if you'd like to book a consultation. Our surgical PCC, Nicole Black, will reach out to you to get you scheduled. And lastly, there is about 15 to 20 minutes that will be on after the webinar is over. You can drop all of your questions in the chat box below and you will be answered promptly.
Hi, everybody. I'm Nicole Black, patient coordinator with Dr. Korman, and the man of the hour, Dr. Korman, is here. And I appreciate everyone taking the time this evening to join us, submitting your questions. Please keep them coming as we'll be able to answer them now. Perfect. So the first question, Dr. Korman, can the max lift really be done under local anesthesia? Does that mean no anesthesia? You don't have to go under?
Yeah, well, that's actually a really good question. And the short answer is yes. With the max lift, you have four choices with anesthesia. You can do it with no anesthesia. If you want to drive yourself home, you can just have numbing medicine like you're at the dentist. And yes, you can. I would say a minority of people choose that, but yes, you can. The next option is to be, again, just numbing medicine, but with a pain pill. So in that case, you can't drive yourself home, but you can, basically, you're not being put to sleep, and it's literally just a pain pill. And the operation takes about 2 hours. So it's really not the problem with longer surgeries is that you, after about 3.5 hours, you have to go to the bathroom. And that's where it's a problem if you're not asleep. But this is a shorter 1.5 to 2 hours, and you can absolutely not be asleep. If you want to, you can also do sedation, which is IV sedation. Again, you're not asleep, but it's more like that you're kind of on a floating away, floating on an island, and that, or like a colonoscopy, that again, you can't drive yourself home, or you can be asleep. I would say the majority of people do not go to sleep. The majority of people don't go completely just numbing medicine, and most people do the middle two, either just a pain pill or IV sedation.
And then another question. So, does age or elasticity of your skin have an impact on the results for either of these techniques or procedures?
So we age four ways. We age with gravity, we age with atrophy, with our fat in our faces go down. We age because of dynamic wrinkles. Those are the wrinkles that are formed when we animate, when we smile, when we frown. And then there's the texture that comes from sun and aging. So that is the four ways we age. To answer your question is that when the elasticity, of course, if you're younger or you have more stronger skin tone, that definitely makes a difference. But what is good, and this is what I was trying to explain in the video, the pulling on certain layers in the face does help to suspend the tissues, and then you can pull gently on the skin so you don't end up with weird spread scars. You don't look like all the things you don't want to look like that you read about or see. And it is how you get natural results that are long lasting.
And then a lot of questions here, kind of just on costs for both of them. So I would say at the end of this webinar, you'll receive a text. Reply face to the text, and I'll be able to reach out to you to answer any more questions and provide more kind of customized pricing. Kind of going back here, it looks like where is the surgery performed?
So we have several offices. The surgery is all done at Hospital Drive Surgery Center, which is in Mountain View. It's our surgery center, adjacent to the offices in Mountain View. It's a fully accredited ambulatory surgery center directly across the street from El Camino Hospital. I built that facility more than 20 years ago. So I get to pick the anesthesiologists who are all very highly trained anesthesiologists that work at El Camino Hospital also. And we try to make it like the Cheers bar where everybody knows your name, so that it's surgery is always a little scary. But as I always tell patients when I'm taking them from the photo room to the operating room, two things. We follow the yellow brick road, and you take first star to the right and straight on till morning.
And a question that just came in is how long does it last? So I guess either procedure, if you could kind of quantify the longevity of it.
Yeah, I think it depends on the person, but they both last for years. I would say that the max lift is more like a few years, and the deep plane facelift can last for a long time. I have patients that I operated on 20 years ago that are still happy with their results, and I have patients that with the max lift that at least 5 years, 6 years, 7 years. What the deep plane has also done is to create that really exceptional look in the neck. There was an old version of a deep plane, and there's the more modern contemporary deep plane. But to answer your questions, it's years, from a few years to many, many years.
And then, so we know the sedation type for a max lift, we can do local, we can do conscious sedation. How about for the deep plane facelift?
So the deep plane facelift is usually done asleep, but it is important to understand that you're still breathing on your own. It's really important to me that there's no asleep that you can't I can't see how your tissues move. So you're breathing on your own, and which means you wake up really quickly, and tends to be really easy. The main issue about doing it with less than a sleep, with sedation or with being awake, is just that the operation takes between 3.5 and 4 hours, which is right around the time when people's bladder get filled and you need to use the bathroom. And I've tried it. It's not really fun. Somebody has to go to the bathroom and they have to get up to go to the bathroom, but they can't because etc. So that's why deep plane is asleep but not paralyzed.
And does a deep plane facelift help with tear troughs at all?
So deep plane facelift is more the jowls and the neck. Tear troughs more involve the lower eyelid with the midface, and certainly can do that at the same time as a deep plane facelift.
And had another question too about doing rhinoplasty. I mean, are there other facial procedures you can do at the same time as these max lift, deep plane facelift operations?
Yes, you can do rhinoplasties, you can do upper blepharoplasty, you can do lower blepharoplasty, you can do brow lifts. The thing that's good about the face and neck is that a lot of these procedures work together, and because you're all in one zone, you don't spend a lot of time moving around or flipping or anything like that. So it's quite efficient and quite easy to do it. And the good thing is that you, the patient, kind of gets to choose what's important to you, what to do. But yes, you can do all these at the same time.
I think what's nice about doing it at the same time is it's one recovery time. It doesn't add to your overall recovery. So doing them in junction with each other is essentially sort of a one and done type of procedure. So love this question. So what can I expect in terms of scarring?
Well, the good thing is there basically is no scarring. Now, I mean, that's not really, that sounds easy to say, but it's the scarring is really hidden. You can wear your hair up. I don't shave any hair. The whole idea is to take out skin that is not hair bearing so that you don't have to lose any of your hair bearing skin. And the eyelid skin is the thinnest skin in the body. So is it possible that some people will get scarring? Of course. I'm not trying to say never scarring, but and Nicole, who has worked with me for many years, I mean, she sees all these patients, so she's probably the better one to ask about scarring.
I always tell patients the first time I talk to them is that usually what we hear and the goal is that your hairdresser, your esthetician, the people that are close up to your face, close and personal, that they don't notice it when you're healed. That's usually what we hear from patients. I always tell anyone I'm speaking with that that's really Dr. Korman's, magic and artistry is the incision and how it's kind of artfully, done right in the ear. So overall, I'd say scarring's really imperceptible. And then, so we have one person who wrote in. So she's a younger person. She's in her 30s, but she's lost over 100 pounds and wants to know what age range do people typically get these type of facial procedures?
So I think what has helped a lot in the last few decades is it used to be that at the age of 50, people would have facelifts. They would have the whole thing. And 50 of 30 years ago is not 50 of today. And yes, a lot of people have successfully lost a lot of weight. So these operations are designed for, to say any age is not really the case, but it's when the tissues have released. And when you lose a lot of weight, in some people, it causes relatively early descent of these tissues. Some people, not so much. So we do have lot of non-surgical treatments that help until essentially till what I was saying, till the SMAS is mobile. When the SMAS is fixed, you really don't need surgical intervention. I can't reach through the computer and tell you, but in person I can tell you really quickly how to time it. And people say, well, is this the right time or should I wait? I think it really depends on the person, and when you feel that your tissues are bothering you, something is bugging you, and losing a lot of weight in some people does create the descent in the face that wouldn't happen till later on in life without the weight loss. So the short answer is it can happen at many ages, and that's why we're here to help.
And kind of answers another question to follow that is if it's better to get a lift before you age too much. And I think Dr. Korman kind of touched on something that I always agree with, is that it's time to do something when it bothers you enough. So I think if it doesn't bother you, you can live with it. There's a ton of non-surgical options too. But I would say, you know, the moment you wake up and it bothers you enough to kind of inquire, maybe then it's time to visit doing something. And that's where we can help guide you on what the right option could be for you.
And I certainly do not want to operate on somebody that's not ready. Doesn't help you, doesn't help me. So it's really, what are the things that you can do? And we're all aging. That's part of who we are.
And, you know, another thing I just, you know, Dr. Korman often tells people too with these procedures is that it's part preventative, part corrective, and everyone's at a different place in their journey. So he really does tailor his technique based off your goals and your needs and where you're at in that journey. Let's see. Will there be a need for Botox or fillers after having surgery?
Well, I would say probably, but only if you want it, because remember I said earlier there are 4 ways that we age, and Botox and fillers tend to go for some of the reasons that we age, and sometimes people don't want to have surgery, and so they'll do Botox and fillers to the point where it's not really helping them, but they do it because they're afraid of surgery, they don't want to do surgery. And I would say when you do have surgery, it's good to maintain your investment. You've invested a lot for yourself, and you want it to stay good. So what you choose is completely, of course, up to you. But fortunately, in all of our offices, we have nurses that can give you a good explanation and consultation. And I'm always happy to help too in what might be useful for you. So fillers are, as we age, there's like hills and valleys. So what does fillers do? They fill up the valleys, and lasers and things take down the hills. And it's important to understand, you know, what are you trying to accomplish? And Botox partially deactivates the muscle, so you don't get so many wrinkles when you frown. And so all of these things are part of what's happening. They help in areas that surgery doesn't, just like surgery helps in areas that Botox and fillers don't.
And then, so I have one person here who has about 30 or more pounds to lose. Should she wait until she's done with her weight loss before doing a facial rejuvenation procedure?
So I generally say if it's 10 or 15 pounds, then that's fine. You can do it. If it's more than that, then yes, you should probably wait. But it's also important to be at a stable weight. You don't want to be at a weight where you're bouncing up and down, and it's not like some magical number that's 30 pounds less that either you never can get to or you end up having to starve yourself just to get there. It's because it's important as we lose weight, the more we lose. Remember, I said one of the ways we age is atrophy of our tissues and loss of fat in our face. So if you lose too much, then your face can get really gaunt. And while we can do some things with fat transfer and things like that, you're trying to look as good as possible, and you don't want to lose the youthfulness that comes with volume in the face.
And it seems that we've had a few people, on a weight loss journey too, who are typing in questions, some that have lost 50 pounds or more. So seeming like, happy with the weight loss, pleased with everything, but maybe lower face and neck need a lift, and wanting to know which procedure is right in this instance.
Yeah, so I would say that it really depends on the person and how much you've lost in your facial tissues, then how much you lost in your body. And in general, when people have lost more than 100 pounds, that's a different thing than people have lost 50 pounds or 30 pounds. And it also depends on your age. If you lose 50 pounds at 30, that's different than losing 50 pounds at 50 or 50 pounds at 70. So I would say the easiest thing is just ask me and I'm happy to help you.
If someone says that their neck is most bothersome, do you think that the deep plane's a better option or a max lift?
Yeah, if the neck is the main thing, then probably a deep plane, which will give you the best result, unless you want to, like they do in My Big Fat Greek Wedding, where they all stand and hold each other like that. You can do that, but it's a little hard because what are you going to do with your hands? So yes, deep plane is usually if it's your neck that's bothering you.
And kind of going through here, so lots of questions about other services. We offer so many services. We have 3 offices, opening a 4th too. So full med spa aesthetic services with our nurse practitioner, some amazing, rinked injectors. So questions about wrinkled hands, about best peels for skin types. I'd say for wrinkled hands, it depends. There's things like laser resurfacing. We have long-lasting fillers like Radiesse that can all be done here. So I'd say the best thing you can do, reach out to us, text back after this, and we can get you scheduled with a consultation for some of our non-surgical services, skin assessments, or with Dr. Korman as well. Yeah, lots of hyperpigmentation questions, skin wrinkling. So I would say these are also customized treatments that we really, again, like to tailor the technique, the machine, the device to the individual. So reach out to us. We can get you scheduled to really give you that customized plan. And then does the max lift the neck somewhat, a little, not at all?
I think it actually does. Again, I try to say I promise and over deliver. I'll use me as an example, and I haven't had any of the surgery. But you see, if I was going to do a max lift, you just look at my bands in my neck, see, go like that. That's what it does. It's not that, but it's that. So the short answer is yes, it does help. And in the pictures we showed in the video of the max lift, you could see that it was helping the neck also. It's just that when you have really a lot in the neck, and also it depends how long you're looking for it to last. If you're looking for a really long lasting one, then the face and neck the deep plane is better, but it's definitely the max does do quite a bit.
And just, as a reminder to everyone, you'll be receiving a text message once this concludes, and just reply with the word FACE to that text message to be contacted for a consultation, whether surgical or non-surgical. Happy to assist with scheduling both. How about Dr. Korman? Would you recommend doing a facelift before or after a breast implant reduction procedure?
I think it depends which bothers you more. I don't think it matters. It's your personal preference.
And if you get a max lift now, can you get a deep plane facelift later on in life?
You bet. That's what's really good about this. You're not burning any bridges. You definitely can. You can. We really try to make it so that we give you all these different options, and wherever you are, as Nicole says, on your journey, we're happy to join you for for people that hike the Pacific Crest Trail. We can help you at the beginning. We can help you for a short time if you're in Yosemite, if you're near the Oregon border in Canada. We can join. We can join in many places.
And in vice versa, if you do a deep plane now and you need a touch up later in life, you can do a max. I'll say they're interchangeable in that sense. So, perfect. And then rhinoplasty question. So that is done with general anesthesia in most cases. It depends a little bit on what you're looking for. If it's just kind of a alar reduction, that can be done under local, but bridge tip tends to be more general. Again, would encourage you to reach out after. We can coordinate a call. It can help kind of answer some questions and give you more guidance on that one-on-one. Wonderful. Well, I think that's kind of wrapping up here. I really, really appreciate everyone taking time out of their evening. Dr. Korman, thank you for answering all these amazing questions.
Thank you, everyone, for joining in, and hopefully it wasn't too long. It was short enough to give you the attention span and that you were interested and that we provided some information. And we're always here to answer any questions.
Yeah, and I'll say the last one that came in that we actually didn't touch on is these are all drainless operations. Dr. Korman does not use drains for the facelift or max lift procedure.
Yeah. Yeah, I don't.
Wonderful. Well, thank you so much, everybody. We appreciate your time.
Thank you, everybody. See you soon.